Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide the update for COVID-19 in Simcoe, Muskoka. So at this point, we have 4,834 cases. This is up by 472 since I last reported on January the 12th. I would like to note that we have had a very tragic large number of deaths occur over the past week. We've had a total of 16 deaths. 13 of those deaths are from long-term care facility or institutional outbreaks. But I would like to express my condolences to the family members of those people who have passed. So they consist of the following individuals: a woman between the ages of 65 and 79 in Simcoe County, a woman between the ages of 65 and 79 from Simcoe County, a woman in her 80s from Simcoe County, a woman above 80 from Simcoe County, another woman above 80 from Simcoe County, a woman between the ages of 65 and 79 from Simcoe County, a woman above 80 from Simcoe County, a woman above 80 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a man more than 80 years of age from Simcoe County, a man more than 80 years of age from Simcoe County, a woman between the ages of 65 and 79 from Simcoe County, a man more than 80 years of age from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, and a woman more than 80 years of age from Simcoe County. This is certainly the greatest number of people who have passed away in a week in our history in Simcoe, Muskoka from this pandemic. I do note that for the first time in 10 weeks, our case count has actually gone down a bit. So if we look at the week of January the 10th, forward to the 17th, we had 450 cases, which is down from the previous week, which was 495 cases. So this is the first time we've had some reduction. I always express caution about optimism. It's certainly a good thing that that is down. I very much hope that that's the beginning of a trend, but at this point it's a little too soon to say. Certainly it's a better thing than if it were going up. I would like to reflect a bit about the people who've passed, the deaths that we've seen over the course of our pandemic. And if we look at different time intervals, I think it's really important to note that we've had many more deaths now in the second wave than we had in the first wave. So if we look at the number of people who passed away from the beginning in March until September the 28th, we had 39 deaths. And since that time, we've had 52 deaths. So in every way, I would say that the second wave has been more severe, and including with regards to death, more severe than the first wave. When I look at the age range for these, in the first wave, we saw an age range between people in their 50s and people in their 90s as those who passed away. In the second wave, the range has been between a person in their 30s and people in their 90s. We've noted that in both waves, the great majority of people were 80 or above. So in the first wave, 59% of people were 80 or above. And in the second wave, between September the 29th and November the 7th, it was 82%. From November 8th onward, it was 51%. So we're seeing some younger individuals among the more recent people who have passed away since November the 8th. The great majority of people who have passed away throughout the pandemic have been in Simcoe County as opposed to the District of Muskoka. The District of Muskoka has seen a total of 3 deaths throughout the entire pandemic. The great majority of deaths have occurred in institutional outbreaks. So in the first wave, up till the end of September the 28th, 67% of the deaths took place in institutional outbreaks. From September the 29th to November the 7th, it was 91%. And from November 8th onward, it was 61% of deaths taking place in institutional outbreaks. We've also had more institutional outbreaks in the second wave than in the first wave. Depending on the timing and when you consider waves ending, but if we considered the first wave over on September the 28th, then we had a total of 26 institutional outbreaks, and in the second wave, we've had a total of 35 institutional outbreaks. So far this week, we've had 126 cases from the weekend through to now, and in the past day, we've had 75 cases. 44 of them were sporadic, 28 were from institutional outbreaks, and 3 community settings. 29 of them were males, and 46 of them females. Their ages were ranging from less than 10 to in their 90s. All of them live in Simcoe County. 14% were community acquired, meaning that we don't actually know how they acquired their transmission. 15 of the cases were close contacts with other known cases. 28 cases were from institutional outbreaks, and 3 from community setting outbreaks, and 15 under investigation. 51 of these cases are self-isolating at home, and 24 are isolating in their facility where they live. At this point in time, we have 1,348 active cases. In January, we've had a higher incidence of cases among females than males. A total of 264 cases per 100,000 population, compared with males of 230 per 100,000 population. This may be reflective of the institutional outbreaks that we've had in long-term care facilities, where there's a larger population of females than males, and also healthcare workers have a higher number of females than males. We have 37 cases in hospital, up from 33. They range in age from their 30s to their 90s. All are from Simcoe County, and 4 are in the intensive care unit. Currently, we have 20 outbreaks, down from 22 a week ago. 7 in long-term care facilities, 3 in retirement homes, 2 in hospitals, 3 in congregate settings, 4 in workplaces, 1 in a community setting, none in educational settings at this time. So in terms of our institutional outbreaks, which would be hospitals, long-term care facilities, retirement homes, we have 12 institutional outbreaks, up from 11 a week ago. 3 are new, 1 at the Waterford Retirement Residence in Barrie, 1 at Bradford Valley in Bradford, and 1 at IOOF, long-term care facility in Barrie, and 2 declared over, Woods Park Care Center in Barrie and Simcoe Manor in Beaton. We have 3 outbreaks in congregate settings, down from 5, so 2 group homes in Simcoe County and 1 treatment facility in Muskoka. And we have 2 that are declared over since I last reported, a transitional facility in Muskoka and a shelter in Simcoe County. We have 4 workplaces in outbreak, down from 5 a week ago. A new one at a warehouse in Simcoe County, and 2 that are declared over since I last reported. One financial service in Simcoe County, and 1 business, a realty office in Simcoe County. We have 1 community setting with an outbreak, a service location, community service location in Simcoe County, and 1 that was declared over, a food and beverage establishment in Simcoe County. So the weekly incidence of cases has actually reduced compared to the previous week, in keeping with the reduction in the number of cases. So this is the first time that's happened in a long time, and that's a good thing, although I know with caution we need to wait and see if this becomes a trend that we would like to see. Specifically in Simcoe, Muskoka, we've had 75 cases per 100,000 population per week, which is 10% lower than the previous week. And the province's incidence has also declined over that week compared to the previous week by 17%. The vast majority of our cases have been in southern Simcoe and in Barrie, so Barrie, Bradford, West Gwillimbury, New Tecumseth, Innisfil, and Wasaga Beach, although we do have significant number of cases throughout Simcoe, Muskoka. Bradford, West Gwillimbury has had the highest incidence of cases at 182 cases per 100,000 population, but this is down from what it was the week before at 228 cases per 100,000 population. And this is the 5th week in which they've been above 100 cases per 100,000 population. They have the highest incidence in Simcoe, Muskoka. And the other municipality in Simcoe, Muskoka with a case rate above 100,000 is Barrie at 124 cases per 100,000 population. So we have good news with regards to immunization, and Simcoe Muskoka District Health Unit working very closely with RVH. Together we've worked very hard. Some support from City of Barrie with regards to the location of our clinic on Sperling Drive, and from Simcoe Paramedic Services with regards to aftercare. We've received support from other agencies as well that I will speak to later in my report, but I definitely want to commend everybody involved. So we maintain a high rate of immunization to date, over 13,000 doses, so in total 13,317 doses were delivered as of yesterday. And in particular, over the past week, we immunized the residents of all of our long-term care facilities. That was finished on Saturday, and I'm very happy about that, very proud about that, because that provides these people with a strong degree of protection. It'll be stronger yet when we can get to them and give them their second dose, but even with a single dose, they get quite a bit of protection. And these are the most vulnerable people in all of Simcoe, Muskoka with regards to the risk of COVID-19, of becoming part of an outbreak and having a severe outcome, including death. So a total of 4,484 caregivers and staff in our long-term care facilities and retirement homes have received their first dose. And we've also had 538 of such individuals receiving 2 doses, their second dose, so fully immunized. And we have a total of 5,148 healthcare workers and in hospitals, as well as residents in those hospitals that are in chronic care units that have received their first dose. We've got nearly 90% or 2,845 residents in long-term care facilities that have received their first dose. And beginning this week, yesterday and today, we were vaccinating residents in long-term care facilities. Unfortunately, very unfortunately, we just had the breaking news that the supply of Pfizer vaccine is going to be severely diminished in the weeks to come, in the remainder of January and into February. And because of that, we need to take stock of exactly what our approach is going to be. We have numerous individuals, healthcare workers, and for that matter, residents in long-term care facilities and some in retirement homes, essential caregivers, and patients in the chronic care units within hospitals who received their first dose. We need to plan to be able to give them their second dose, and we certainly want to be able to continue providing protection, immunizing individuals, residents in the retirement homes that we've not managed to get to yet. And there are many others, of course, that we need to get to in the near future, including healthcare workers in the community and paramedic services personnel and others. Those are people whose roles, their exposure to COVID-19 make them a priority to receive vaccine. But at this point, we do not know, and we need to assess and look at what may be coming to determine when we can move and proceed with providing vaccine to those individuals. We have to take stock of the information we've just received and get more information about the details of what it means before we can decide what to do. So that is certainly bad news. I think we'll be fine in the long run when supply begins again, and we get on into the months to come, and supply is much more plentiful, and we can move on, provide immunization to those individuals, make sure we can provide a second dose to individuals, but also get ready to be able to expand immunization in the community at large, working with community partners, family physicians, pharmacies, and others. That will come, but at this point in time, we have this bad news about the immediate weeks ahead of us. With regards to our dashboard as a health unit, we remain in red status. This is a dashboard we've set for ourselves. It's not the province's framework that they had been following before they issued the shutdown and then the state of emergency and the stay-at-home order. So we continue with our framework, and we remain in red status. Certainly with regards to viral spread and containment, we still are in red status. Even though we've had some improvement now. With the laboratory testing, we are in yellow status. This is because of the test turnaround time still being more than a day, generally speaking, for us to get the test results. But we have had some improvement now with the test positivity rate. So test positivity rate is a combination of how much transmission is happening in the community and how much testing is happening. Are we doing enough testing? And so you want a very low test positivity number. Generally below 2% is desirable. Ours this week is 2.8%, which is down from 3.5% a week ago. So it's still relatively higher than we would like. It's certainly lower than the provincial rate overall, and it's come down a bit, which is a good thing. In terms of the health system capacity, we have categorized that as red, and the reason for that is we've noted an increase in occupancy in the intensive care units, and at this point in time, it's a 65.4% occupancy above the desired cutoff of 60%. We've also got acute care bed use in yellow status. So overall, the health system capacity is designated as red. Public health system capacity remains in red, and this is because we continue to be challenged in our ability to follow up with our cases and our contacts. We continue, for the most part, not being able to reach new cases within 1 day. So we're reaching within 1 day 76% compared with our goal of 90%. But this is actually an improvement, and it probably speaks to the fact that with a reduction in cases that have been happening over the last week, it's easier for us to get to the cases. In terms of our trajectory, as I've indicated, our incidence of cases per 100,000 population has come down, so 75.7 cases per 100,000 population per week, down from 83.3 per 100,000 population per week. The daily average growth rate is down to 1.4. It had been 1.8 a week ago. The reproductive number is 1.0, so anything above 1 means that there's growth. Anything below 1 means that there's shrinkage in the pandemic locally. And this is down from what it had been a week ago at 1.2. And our doubling time has increased, which is a good thing, that you want a very long doubling time, the time before you've doubled your number of cases. And so ours has increased to 49.5 days. And that's greater than it was a week ago. So on the whole, the week has been improving with regards to case count, certainly up though with regards to mortality, certainly up with regards to our active case count as well. Roberta Place, long-term care facility in Barrie, and certainly this has been a severe outbreak. To date, we've got posted on their website from the facility, they're indicating that they have 92 positive resident cases and 57 positive staff member or team member cases. And they've also noted 12 residents who have passed, 10 of whom are a result of the virus. So we receive their information. We have to assess it for ourselves and enter that information. So we have the following information from our own data, noting that some of it we need to check before we enter the data. But according to our data, we're aware of 8 deaths, which is up from 1 a week ago when I last reported, and 65 residents who've had tests that have been confirmed to be positive, up from 40 when I reported a week ago. And I would also note that there was on-site testing yesterday at the facility with a team from Aurelio Soldiers Memorial Hospital using their rapid test that they have at their available at their assessment center at the hospital, which showed an additional 22 positive COVID cases. So 22 on top of the 65 that we know of. Those 22 would need to be laboratory confirmed by the province as well. We also note that 4 of their residents are admitted to RVH for care. And we also note that the number of positive staff cases, according to our data that we're aware of, is 56, up from 2 cases a week ago. So an enormous increase in the number of staff, enormous impact on the facility because of the number of staff that have been impacted. We note that the Red Cross there's been, as I said, a lot of response to this situation. So we've had the Red Cross do assessment for infection control and are preparing to bring in personnel. We've had RVH do that kind of assessment, assist with testing, use their infection control hub, and certainly we've had Simcoe County provides some expertise as well with regards to infection control, and we've had an offer of assistance with students, healthcare students from Georgian College, preparing to come online to provide assistance. And also we've had Simcoe Hospice Simcoe provide personnel as well in order to provide care for the residents. And also Simcoe County Paramedic Services assisting with immunization. On Saturday we were on site immunizing residents, essential caregivers, and staff. We certainly want to be at locations where there are outbreaks happening to be able to provide that additional form of protection with immunization. But we're not able to immunize those who are active cases, those that have symptoms, or those that have tested positive for COVID-19, because the vaccine wouldn't be able to help in that situation. So we immunize those that don't have symptoms, don't have positive tests. And so because of the size of this outbreak and the number of people impacted by this outbreak, we were limited in how much immunization we could provide to the residents. We were able to immunize 21 out of a total of 140 of their residents, so 15% of their residents were able to immunize. 46% of their staff and essential caregivers have also received immunization.
The percentages you gave of residents who are immunized against staff who are immunized, some of them are quite different, ranging from 80% of residents or 90% of residents to 40% of staff. Is that because it's a staff choice or a resident choice, or you can't get all the staff at once, or how does that work?
It's a very good question. Everybody has a choice in this. The residents or their caregiver, their family member, if they've given them that choice, if they aren't able to make that choice themselves. And what we've noted about staff is they've not had the same degree of options as the residents. The residents, we were able to go to them and make it very easy. The staff, we were providing it for the most part at our clinic on Sperling Drive in Barrie, and that meant a drive, and for some a long drive. We did see some better uptake closer, those that live closer versus those that were farther away. And we also noted in the instances where we were able to provide it to staff at the facility when we arrived, which was limited, but in some instances we were able to do that, we had a higher uptake, more like 70% instead of 50%. So if you make it more readily available to people, you're going to get a higher uptake.
So it comes down to more accessibility than people refusing to get the vaccine, is what it looks like in these cases.
I believe so. And that is an important lesson for us. When we go forward with immunizing the broad community, that's an important lesson for us. We need to have multiple locations throughout Simcoe, Muskoka to do a really good job.